We stand at a generational turning point. Our children of the sickest generation in modern history, and decades of failed policy, captured agencies, and profit-driven systems have caused it. Parents across the country demanded change, and we are delivering it. We are ending the era of federal policies that fueled the chronic disease epidemic and replacing them with policies that put the health of Americans first. President Trump and I are challenging the status quo and the institutions that defend it as we work to make America healthy again. In just 15 months, HHS has delivered historic wins. We negotiated most favored nation drug prices with 16 of the largest pharmaceutical companies, so Americans no longer pay more than other people in wealthy countries for the same medications. We're bringing real transparency to healthcare pricing so patients know the cost of care before they receive it. I use the full convening power of the federal government to bring health insurance CEOs to the table to reform prior authorization. We are cutting red tape, speeding decisions, and demanding transparency. We are also cracking down on waste, fraud, and abuse. This year, HHS and USDA issued new dietary guidelines that put real whole food at the center of the American plate. We flipped the food pyramid upside down and sent a clear message to the American people: eat real food. HHS has also opened the door to partnerships with industry, trade associations, nonprofits, and advocacy organizations. More than 50 medical schools have committed to expand nutrition education from an average of just 2 hours to 40 hours. Food manufacturers are stepping up too. More than 40% of the food industry is committed to phase out petroleum-based dyes by year end, and many have already eliminated them. In conjunction with these efforts, FDA approved 6 natural food colorings derived from fruits and vegetables. Though President Trump's Great American Recovery Initiative, HHS is matching compassion with action to help Americans break the cycle of addiction. At HHS, we are prioritizing patients with ultra-rare diseases and their families and driving faster access to life-saving treatments. We're restoring gold standard science and integrity across the agency. We're protecting children from sex-rejecting procedures that expose them to irreversible harm. We're eliminating outdated and misleading warning labels on hormone therapies used to treat women during menopause. We're strengthening oversight of organ procurement. We're implementing Operation Stork Speed to ensure the safety and quality of infant formula. We're applying the same focus and urgency, as you mentioned, to rural America. The Rural Health Transformation Fund delivers the largest investment in rural health in our nation's history, $50 billion over 5 years to strengthen hospitals and ensure Americans can access the care they need no matter where they live. Members of Congress on both sides of the aisle have made rural health a clear priority in their conversations with me, because every state is feeling the strain of hospital closures, workforce shortages, and gaps in access. HHS announced more than $135 million investment this month to expand rural residency programs and nutrition services. The data is clear. When physicians train in rural communities, they're more likely to practice there. The president's budget puts all these priorities in action. It invests in prevention because preventing disease costs less and delivers better outcomes than treating it. As my uncle, President John F. Kennedy, said, progress is a nice word, but change is its motivator, and change has its enemies. We see those forces clearly: entrenched interests, defenders of a failing status quo, and institutions that put profits ahead of the American people. That resistance underscores the urgency of this moment. We can reverse the chronic disease, improve public health, and lower costs. I stand ready to work with this committee and Congress to seize this opportunity, to implement and codify lasting generational reform in American health care. For our country, for our children, and for the healthy American people, together we can make America healthy again. Thank you very much.